Today you reported to duty as a doctor and you find that 70 patients have same symptoms. All those symptoms are not just similar, but the intensity and the severity is also the same. But one thing is common, they all are not from the same area, are from different areas, but they all have reported to the hospital and they all have similar symptoms. What would you do? You'll immediately alert the healthcare authorities or the hospital management that any such patient who is coming, we need to deal with care. And that's something where it must remind you for the COVID-19 pandemic, right? When we look at healthcare data, it's totally fragmented, not centralized, and at the same time, nobody has time to analyze. So data is fragmented, not centralized, nobody has time to analyze, and on the top of it, there is ethics surrounding patient data. On the top of it, if this is not solved, that is where disasters happen. If there are patterns which can be seen, we can always prevent it, avoid it, or improvise on it. Let's take example of antimicrobial resistance. After so many cases of superbugs, people finally realized, okay, there is AMR, right? What if we had realized it early on, right? So this can be, or many such patterns in healthcare analytics can be done if we can integrate, centralize, and analyze data. And that is where AI comes into picture. AI in healthcare is a boon, but we should not resist it. We have to learn the AI tools. We have to learn how large language models work, how exactly it analyzes the data, what can be the mistakes it can do, because these mistakes can be costly to the patient's life. Today, AI is already doing diagnostics for radiology, pathology, cardiology, oncology, ICU, and ER. Today, AI is able to read millions of patient data within seconds, detect patterns which is invisible to human eye, and predict disease risk which appears even before the symptoms appear. We can save so many patients even before they get hospitalized, even before they feel sick. That is where AI comes into picture. But there is a big caveat, and that is AI is not accurate. And that is an opportunity, my dear friend. If you learn AI ML in healthcare, you can train the AI to become accurate. And then you own that tool and you can sell to millions of doctors. And only a doctor can do that. And that is why I'm urging all my doctor friends, all my clinician friends to learn AI ML in healthcare. So stay tuned on Meditechnica because we are going to come up with an AI ML in healthcare training program very, very soon. Once it happens, you can always enroll and learn all of it online. And then while you are treating your patients, you can find patterns and treat them even before they know they're going to have the disease. All the best.